Wisdom teeth are a set of molars located at the very back of the mouth. You can have up to 4 wisdom teeth, one in each corner of your mouth. These are the last teeth to develop in your mouth. They typically appear between ages 17 and 25, supposedly the age of wisdom, which is where they got their name. Wisdom teeth were really helpful for our ancestors who needed extra chewing power for their rough diet of raw plants and tough meats. But nowadays, with our softer diets and smaller jaws, wisdom teeth often cause more trouble than they're worth. This evolutionary change means that most modern humans don't have enough room in their mouths to accommodate these additional molars. When wisdom teeth try to come in, they often face a lack of space, leading to various complications. This crowding can cause the teeth to grow at odd angles, become trapped under the gums, or impacted, or even partially emerge, making them prone to infection. What's really interesting here is that wisdom teeth issues are incredibly common, with studies showing that around 85% of people will need to have their wisdom teeth removed at some point. Types of wisdom teeth. There are several ways wisdom teeth can develop and position themselves in your mouth. Number 1. Fully erupted wisdom teeth. Some wisdom teeth are fully erupted, meaning they've completely broken through the gum and grown normally, just like your other molars. If they're properly aligned, they can actually be useful for chewing. Number 2. Partially erupted wisdom teeth. This type of wisdom teeth have only partially broken through the gum tissue. This is often problematic because it creates a perfect hiding spot for bacteria, leading to infections. Number 3. Impacted wisdom teeth. Impacted teeth are those that get stuck under the gums or in the jawbone. They can be impacted in different ways. Some grow horizontally towards other teeth, while others grow straight but remain trapped under gum tissue. Some grow at an angle towards other teeth. You might have soft tissue impaction, where the tooth is partially covered by gum tissue, or bony impaction, where it's completely enclosed within the jawbone. Causes of wisdom teeth problems. The main reason wisdom teeth often cause problems is simple. Most of us just don't have enough room in our mouths for them. Our jaws have become smaller over thousands of years of evolution, but we're still getting these extra teeth. When there isn't enough space, the teeth may grow at odd angles because they're cramped. They might push against other teeth, causing alignment problems. They can get trapped under the gum or in the jawbone. Sometimes they break through the gum partially, creating pockets where bacteria can thrive. Genetics can play a role as well. If one or both parents had issues with their wisdom teeth, there's a greater chance that their children will too. Genetics can influence jaw size, tooth size, and how teeth erupt, making wisdom teeth issues somewhat hereditary. Symptoms of wisdom teeth. When wisdom teeth start causing problems, you'll definitely know about it. The pain usually starts as a dull ache in the back of your mouth, kind of like a pressure that won't go away. You might notice it more when you're eating or touching that area. Sometimes the pain can spread to your jaw or even give you headaches. Your gums might feel tender and swollen around the area, and they might bleed when you brush your teeth there. If you run your tongue over the area, you might feel a flap of gum tissue that's loose or irritated. Some people experience bad breath that won't go away no matter how much they brush, and there might be an unpleasant taste in their mouth. This usually happens when food gets trapped around a partially erupted wisdom tooth. You might also have trouble opening your mouth fully or feel like your jaw is stiff. If an infection develops, you could experience swelling in your cheeks or lymph nodes, and you might even get a slight fever. Some people find it hard to eat normally because it hurts to chew or because their bite feels different than usual. Diagnosis of wisdom teeth. Getting your wisdom teeth checked out is pretty straightforward. Your dentist will take x-rays that show exactly where your wisdom teeth are and how they're positioned. These x-rays help reveal if the teeth are impacted or if there might be future problems. They'll also do a physical examination to check your mouth and gums for signs of infection, swelling, or other issues. Your dentist will want to know about any previous dental work and any symptoms you're experiencing. Treatment for wisdom teeth. The treatment of wisdom teeth problems largely depends on the symptoms, type of impaction, and your overall oral health. Number 1. Monitoring and conservative treatments. If your wisdom teeth have come in properly and aren't causing problems, your dentist might just keep an eye on them during regular checkups. You'll need to be extra careful about cleaning them since they're hard to reach. However, if you have mild discomfort or minor infections, your dentist might recommend conservative management. This includes using saltwater rinses with warm water and sea salt several times a day, taking over-the-counter pain relievers like ibuprofen, careful cleaning around the area with a soft toothbrush, and using antibacterial mouthwash to help prevent infection. Other than that, applying a cold compress to the outside of the cheek near the affected area can also reduce swelling and numb the pain temporarily. Number 2. Antibiotics for infections. If an infection is present, your dentist may prescribe antibiotics to control the spread of bacteria. Antibiotics are often used as a temporary solution to manage infection before extraction or other definitive treatment. The dentist may also recommend antiseptic mouthwashes to reduce bacteria and keep the area around the wisdom teeth as clean as possible. Number 3. Extraction of wisdom teeth. If your wisdom teeth are causing problems or likely to cause problems in the future, your dentist will probably recommend removal. While this can sound intimidating, it is typically straightforward, especially when performed by an experienced oral surgeon. The procedure usually takes 45 minutes to an hour. You might receive local anesthesia where you're awake but won't feel pain, plus a sedative to control any anxiety you may have during the procedure. In some cases, you may be given general anesthesia where you're completely asleep. This is usually done if the tooth is not fully visible in the mouth. In these cases, the gum over it will often need to be cut, plus some bone will be gently removed to allow access to the tooth itself. Preparations before the surgery. Before surgery, you'll need to arrange for someone to drive you home. Don't eat or drink anything for 6 to 8 hours before surgery if you're getting general anesthesia. Wear comfortable, loose-fitting clothes, remove any jewelry or contact lenses, and tell your dentist about any medications you're taking. Recovery after extraction. Recovery from wisdom tooth extraction generally takes about a week, although some people may need a little longer for full healing. During the initial 24 hours, it's important to avoid spitting, rinsing, or using straws, as these actions can dislodge the blood clot, which can cause a painful condition known as dry socket. A soft diet is recommended for the first few days, with foods like soup, yogurt, mashed potatoes, and smoothies being easier to eat. As the healing progresses, gentle rinsing with warm salt water can keep the area clean and help with discomfort. Avoiding smoking and alcohol during the recovery period is crucial, as these can interfere with healing. Swelling typically peaks around day 3 and should improve after that. Some bruising is normal and will fade within a week or 2. You might have trouble opening your mouth fully for a few days. Minor bleeding can also occur for the first day or 2, and feeling tired for a few days is normal. You should call your dentist if bleeding doesn't slow down after 24 hours, if pain gets worse instead of better after a few days, if you develop a fever, if swelling increases after 3 to 4 days, or if you have trouble breathing or swallowing. At the end, remember, everyone's experience with wisdom teeth is different. Some people never have problems with them, while others need them removed to prevent complications. The key is to stay in touch with your dentist and address any issues early on. Now, we want to hear from you. Have you experienced any symptoms from your wisdom teeth? Are you considering wisdom tooth removal, or have you already had it done? Share with us your experiences and opinions in the comments below. We love to hear them.